So what are your concerns when it comes to your kids' health, especially during the pandemic? We're going to talk about it today with our very special guest. We have Dr. Jodi Lenko from the Lehigh Valley Hospital Hazleton Network. She's going to join us later on the show. But it is back to school, whether it's online or whether it's in person. It's back to school time. It's back to school.
Did you ever see that commercial? It's the most wonderful time of the year, and the parents are like flinging through the stores picking up all the school supplies.
Oh, we do that. Bella's starts back to school shopping like in June. If she could start the day after school ended for the following year, she would, because she just loves all the stationery and the pens and pencils and all that. It's not that she's really excited to get back to school.
Yeah, she just likes getting prepared.
That goes with it.
Is it all sparkly stuff?
Some. Yeah, we have stacks of notebooks. We probably have enough notebooks to cover every kid.
Just in case.
Just in case.
And
you
then she
never
has
know.
all that summer homework to do.
Lots of summer homework. And we're fortunate because Marion is actually going back in person. So I'm excited that she's going back to socialize again and back to all of her extracurricular activities.
Yes. Does Bella like to decorate her locker?
Oh, yes.
And our kids are so opposite, because my children give me a list and they say, get us any notebook, and it's too much effort to decorate my locker. Thank you. So
we get
have
lights
the
and
5
everything.
subject notebooks, but mom is sent to get the books by herself.
Oh no, it's an all-day event when we go. You know, we go to different stores, she picks everything she wants, we go back again a couple of times. I probably spend more on school supplies than I do on her uniforms.
Yes. Oh my God. And what are you going to do for back to school?
Me?
Anna?
I guess I'm going to buy a case of wine and sit back and relax and watch you people go nuts.
Yeah, and enjoy the dogs. Yeah. Rosie. We'll bring Rosie over. And maybe spaghetti.
What are you planning on doing for the kids this year for school? Anything special on the first day?
Bye, Alyssa and Mason, because Alyssa drives now, so maybe I'll just roll out of bed as they're leaving, because they wear uniforms. So our children will get up, go to school. I'll watch them on Life 360, the app, wave goodbye, say be careful.
See you later.
Are they
Pray that we stay 5 days in school.
Yeah, that's the biggie. They probably by now are bored. They just can't wait to get back to school and see the kids.
I think so. I think obviously as a parent, education's first, but I know the socialization aspect is just as important. And I think all of the kids, having been home since March, you know, it takes a toll mentally on them. So I'm excited to see them go back and, like I said, get back to just their regular routine. I love a routine, and I think it's good for everybody to have that routine. So Bella will be enjoying her new routine.
Yeah, that's why we're having this show, because we look at the mental health part of it, and your kids need to be on some sort of routine. My kids have not been on any routine, and I keep telling them 1 more week till school, or 2 more weeks, or whatever it was, and now it's the time.
Yeah, when you and Sam were younger and first day of school would come, I would be really sad though, because we didn't have that much of a strict schedule during the summer. We were able to go places and do things, and I actually enjoyed my kids. So you know, it was like a lot of fun.
This year's been tough,
but this year's been tough because of the coronavirus, the limitations. You're running out of things to do, and it's like, you know, everybody's under your feet.
Well, from, you know, everyone has something that COVID has impacted them personally. And it is, as we're going to talk with our guests, it is how the parents are talking around their children mentally to prepare them. One example, and I know we're going to break, but my daughter was supposed to get her license right during COVID, and she couldn't. So she had to wait. And I could have been like, oh, this is so terrible. I'm thinking, listen, you get more practice time. It's bad weather anyway. So you kind of make a negative a positive for your children, so that you are keeping their mental health strong as we possibly can, as we all get through this pandemic together.
Right. Well, stay with us, because when we come back, you're going to learn everything you need to know about the coronavirus. You're going to meet our special guest, Dr. Jodi Lenko, and tell your friends, call them up, watch us online, watch us on all your devices, as I always say, and stay tuned and watch these commercials, because it's through these sponsors that we're bringing you this show. We'll be right back.
Welcome back to The Girls. We have a special guest today from Lehigh Valley Hospital, Hazleton. We're here with Dr. Jodi Lenko. Thank you so much for joining us.
Thanks for having me. I'm excited to be here.
Well, we have lots of questions about COVID. We know that it has profoundly hit everyone in some fashion or another, whether you know somebody or just, everything we're hearing. And I know myself at the very beginning of it, I was becoming very anxious about, everything you're hearing. I remember going to the grocery store for the first time, and I was standing in the aisle, and I got overwhelmed because, the shelves were cleared off, and I just started thinking, where are we going from here? So one of the concerns and questions I guess I have about it is, especially in children and teenagers, we went from, a very active social life as a teen to March came and everything that our kids did had to stop. School, extracurriculars. What can we do to boost our kids, their mental health during all of this?
Yeah, I think it's a great question. So I'm certainly not a psychiatrist, but I do a lot of mental health in my everyday practice. So I'm a general internist. I take care of mostly adults, but I have children of my own, and I have some training in adolescents as well. So mental health is a huge part of this, and we've seen a lot of mental health problems since March. A combination of work stress, family stress. There's, like you said, our lives were flipped upside down. I think the most important thing that I can stress to people is to just maintain an active, healthy lifestyle and try to find some type of balance with socialization. So with kids, it's tough. You don't want, especially teenagers, when they're at that independent stage that you want to let them go out and be social as they would have, and it's a little challenging, and every situation is a little bit tough. When we were all clamped down, when we had our lock-in, then you had the answer. There was no answers. You're not going out. But now that there's less rules, it's become a little bit more challenging. I think the main thing is to have open lines of communication, making sure your kids are talking to you. Let them express their fears. Let them express their concerns, whether that's to you, a cousin, a grandmother. And I know my kids have had concerns about my grandmother, who's 92 and still alive. And I think letting them express those concerns is incredibly helpful. And sometimes they express them to other kids, so having that, some type of relationship, whether it's, in person safely, or whether it's virtually, or, whatever type of face chatting they can be doing. I think that's important. And then the other part of it is just the overall well-being. So eating well, maintaining good sleep schedules. I've heard of lots of kids that have turned into slight vampires and stay up all night playing games and sleep during the day, So I think as we transition back to school, we have to make sure we're getting back into those healthy habits. And I'm a huge proponent of sleep in kids. Kids need a lot more sleep than we usually let them get, especially in the summer when it's nice and lots of fun things to do outside.
Yeah, as a parent, Lori and I talk a lot because our children are the same age, and obviously we're all family, so we rely on my mom from her experience with, raising me and my brother. But as a parent, you're just frustrated at times to begin with that you don't know all the answers, or you wish you knew the answers. But then you have COVID on top of it, and it does add provided pressure as to, am I making the right decisions for my child? You come into it, we're also human as parents. Our kids think, we should have all the answers, but we're human. Yeah, and when you add into, maybe people are going through job struggles with their jobs, or struggles with everyone being in the house, it is sometimes hard to focus when you say, okay, keep a positive mental attitude, and then sometimes you just want to go in a closet and scream because nobody is getting any time to themselves if everyone is in the same house all the time with no downtime for themselves. So what is your advice for parents to say, take a deep breath? For me, I go for walks just to have my alone time, just for my mental stability.
Right, and I think that's important, is just to make sure that you're taking care of you, because if you as the parent are not in good health, whether that's mentally, physically, then you're gonna be less effective as a parent, both mentally and physically. So I think what you're saying is it's okay to take some time to yourself. Outdoor activities I think are fantastic right now. I'm telling my kids we need to live up every ounce of the sun and every ounce of outdoor that we can right now, even through the fall, because I think that getting that extra outside activity where we can be a little bit more social at a distance and be able to feel comfortable with that is going to be important. and we're entering the winter, and that does, I am concerned. I don't know what it's going to be like, but it is, it is a concern. So just trying to make sure everybody is doing whatever they have to do to stay sane.
You mentioned about having a parent or a grandparent that's elderly. I have a father who's alive and well. He's 92 years old, and he lives in an assisted living. And I think the most difficult part for me through the whole thing, and my stress part, was I was so used to going and visiting my dad 3 or 4 times a week. So that was totally cut off. And I found myself being like very miserable and worried and anxious, and I even had heart palpitations. So I really had to sit down and think, what the heck, is going on here? We were allowed finally to visit, and I just had a wonderful visit, which made my heart so happy, to have a window visit. And it had started raining, and I didn't care. I was sitting there outside that window, and I was going to visit with him. I didn't care, because you have these precious gifts. And that's why I think this has everybody so concerned, because we treasure our family and each other. I mean, sure, you're concerned about everybody, but there's so many conflicting things about what it is. So if you don't have it hitting you right in your family, and if you haven't been hit with coronavirus personally, a lot of people are just like saying, I don't care, I'm not going to wear a mask. How dangerous is that?
The mask situation is probably the most important and effective thing we can do as a community, whether this is a small community, a large community, to make this go away. The mask is the only defense that we have right now until a vaccine comes along. So that's what we have in our power to do. So take control of that, and that also helps. The fact that you are owning something and you can do it, and you can also have your kids do it as well. So it's incredibly important to wear a mask and make it fun as you have.
Yeah. So when you talk to your children about the mask, I know for me sometimes I don't like to wear the mask, but I wear it, and I say that. It's uncomfortable, it's hot, sometimes you feel like you can't breathe, but it's something that is required for us to do. So what are your recommendations for parents when they're talking with their children, going back to school? It's now mandated by the state that children wear their masks at all times during school. So yeah, that's a hard talk.
It is. It's hard. And I think the most important thing is as a parent, you sometimes have to lead by example and just put on a happy face. And we've done the fancy masks. I have pictures of the dog with the mask on, so we've tried to do it. And my kids are smaller, they're 6 and 8. So they, get a little bit more excited about some of those things. But I think just the attitude, it's like not even, and I think especially the younger kids, they're so used to following different rules that this is just another rule to them. I think just as long as it's presented as this is what we have to do if we want to go outside, if we want to go to the store, this is what we have to do. There's not a question, it's just we just do it. So I think that's incredibly important. And then in terms of wearing the mask at school, it is going to be important to wear it all the time, except when you're eating. So our rule in my office is if I can see you and we're in the same room together, then we both need to have our mask on. So it doesn't matter if we're 6 feet, 10 feet, whatever, we're trying to be as safe as we can. And I think that's an important rule in school as well, because even if their desks are apart, they're going to be getting up and moving around. And, I think it's incredibly important to just encourage your kids to wear their mask all the time. It is a part of our new life right now.
What would you advise parents to do to check their children daily before they allow them to go to school, to watch for early signs of anything?
So the most important thing is, yes, to check the symptoms. And I mean, the ones that I look for most notably are the fever and the cough. Those are the 2 most likely signs and symptoms in kids. And that's been, established throughout this. And even though this disease is still pretty rare in kids, those are the 2 symptoms that are most likely to appear. So just make sure that they're upfront with it. And some kids are, they don't want to miss things. And you just have to make sure that they know that how important this is to be incredibly truthful with this information. So the cough, the fever, any type of difficulty breathing, although that's not as likely in kids, and then the other things like the sore throat, runny nose. Because the other thing that's going to happen is the kids are going to get colds, and it's not going to be coronavirus. And I think that's also important to know, that just because you might get a fever, it could be scary. Everybody has been hearing all these things, and it's incredibly important for the parents to say, okay, we're going to take a step back. We're going to, call your primary care doctor, call the pediatrician, call the family medicine doc, find out what we need to do. Don't panic yet. And I think that's an incredibly important point for kids.
I'm going to interrupt you right here and take a quick break. Stay with us. We'll be right back.
How safe are your children now with COVID going around in 2020? We have a special guest with us, Dr. Jodi Lenko of Lehigh Valley Hospital, Hazleton. She's the vice chair for the Department of Medicine, so she knows a thing or two about health. So thanks again for joining us here on The Girls.
Thanks for having me again. It's been fun.
We asked on our Facebook page recently, what is the biggest concern when it comes to your children's health during the pandemic? So we'll get to some of those questions, which we've been hitting on the show, but I promise we will get to some of your questions once we finish the segment.
So before we went to break, we were talking about our kids and going back to school. And so every year since my daughter has started preschool, we go back to school. The first 2 weeks, it's guaranteed she's getting a cold. I almost prepare for it. It's coming. So now with COVID, I think a lot of us will be very nervous when our kid comes home and maybe has that slight fever or is developing a runny nose, a cough. What should we do? Because it may not be COVID.
And that's the tricky part that none of us really know at this point, because we've been because our social distancing has worked during the cold and flu season in the spring. There's not many cold symptoms, flu-like symptoms going around in the summer. So a lot of us this is going to be new territory for a lot of the physicians and the providers too, and the school nurses. God love the school nurses right now. But I think it's just going to be very important, especially with any fever. I get nervous about a fever as being a little bit more likely to be COVID than other things. If it's a little runny nose, a little scratchy throat, and your child typically has fall allergies, just make sure you're in touch with your primary care physician, whether that's the pediatrician, because they can tease out some of the symptoms a little bit easier. And don't be afraid to get them tested. It is not that uncomfortable. It is not that scary. Hopefully we're going to be getting more tests in the future, but right now we still have, at least at Lehigh Valley Hazleton, and Lehigh Valley Health Network is still doing the nose swab. But that right now, as of now, is the most accurate test.
What is considered a fever for COVID?
So a fever in general is any temperature Fahrenheit above 100.4. So that is considered a fever. So, and it doesn't really matter what your normal temperature is, because a lot of people ask me that too.
Okay.
So anything above 100.4 is considered a fever.
So if you take your child's temperature, 100.4 is the spot that they have a fever.
And make sure they have make sure you have a good thermometer that's working. If you're checking your temperature on a regular basis now and you're getting 101, that's probably not an accurate thermometer.
Which thermometer do you recommend?
There's a variety of ones out there. They're all very good as long as they're relatively new and they have good batteries. The temporal artery one is a good one, and so is the tympanic thermometer.
And you also have to watch with if your child was in the sun or sweating, or my son has hair that goes down to here, so sometimes his forehead's really hot. I know we've gone to a restaurant and they said he has a fever, so he had to wait a little bit because he didn't have a fever, he was just overheated.
And that's where the scanners sometimes can be a little bit less accurate, but the ear thermometers are usually good, or the under the tongue thermometers are going to get your internal temperature, which is the accurate one.
I recently had a friend ask me a question to relate to you. How about getting the flu shot? Will the flu shot still be thumbs up? Is it something that'll help with their immune system to help prevent the COVID? Or what's going to happen with inoculations for COVID?
So we don't know any information about whether or not the flu vaccine will prevent you from getting coronavirus. Nobody knows that, unfortunately. They are two very different viruses. The one is a coronavirus and the other one is influenza virus. So they're very different viruses altogether. I don't necessarily think that the flu vaccine will offer any protection, but what we don't know is if getting the two viruses at the same time, what that would look like. If you happen to be infected with the flu virus at the same time as coronavirus, how that would impact you. Judging by how dangerous coronavirus can be, especially in older people, I don't think it would be pretty. So I strongly recommend everybody to get their flu vaccine, especially older adults, anybody over 65, strongly, and anybody in healthcare workers, things like that.
So people who are trying to decide, their children sometimes have a choice to go back to school or to be schooled at home. How do you help that parent make the decision based on their child's immune system, or what would it be?
It's a personal decision because there's so many things that impact it. You have your job, you have your work schedule. Can you care for children at home? Do you live in a multifamily house that has a grandmother, grandfather, uncle? Do you have a child that has an immune system problem that might have recovered from cancer or might have had a congenital heart problem? There are so many different aspects of this. I just try to counsel people and give them the information, and ultimately it's up to you and your family about what decision is best for your children, who are in various stages of learning as well, and everybody has various stages of needs, whether you have a special needs child as well. So there's so many things that impact the decision.
Go with your gut. In the end, right? Go with your gut. So the immune system, we had questions that people were asking. You know, we hit a lot on the mental health concerns, but when they talk about the virus, they said, is the virus really as scary as they are making it out to be? Not sending our kids to school, will their immune systems get worse not being around others?
Now, the best thing you can do for your immune system, so there's no evidence that being exposed to other illnesses boosts your immune system. Certainly by having colds, you do have immunity to those colds later on, but that doesn't necessarily mean that you have a stronger immune system later on in life. The most important thing you can do for your immune system is live an active, healthy lifestyle, and that starts with exercise regularly, whether that's kids and adults, healthy, fruit, vegetable-based diet if possible with some lean protein, and adequate sleep. So if you can tackle those three things, you'll do well more for your immune system than exposing to any other type of virus.
When you're talking about the mask being a great preventative and how good it is to wear the mask, it's not only necessary, but how should a person wear a mask properly? Because I have seen the nightmare masks where they're underneath the nose, or
Like
they have
this?
them pulled down under their
That's how you
chin.
should not wear a mask, just
and
hang it from
then,
your ear.
as Janine has the fabric here,
Not like
how many times should you wear that before you wash it? What's the rule? I wear a clean mask every time.
That's the recommendation, is to wear a clean mask every day, is to wash it. Now, don't forget, the mask that you're wearing is protecting us from you. So that is a mask and if everybody does it, that's how everybody is protected. So it's designed to be worn over the nose to try to have as few holes as possible. So hanging on your ear, not going to work. Pulling it down below their nose, which a lot of
Below the chin?
below the chin doesn't work. Another question I get is face masks. Face masks are not the face coverings, just like the plastic shield is not enough. It's okay to do in addition to a mask, but it's not enough. And then washing it every day if it's a cloth mask.
What about a handkerchief or a sweater? Now, I actually saw online now they're making sweaters that go like this around. It's like the COVID sweater.
Anything is better than nothing.
Okay.
So anything is better than nothing. We do recommend at least 2 layers of fabric. So that's where the sweater or the handkerchief sometimes isn't quite as effective, but anything is better. The whole idea is to try to prevent my saliva, these small little droplets from getting far out into the air. So that's the whole purpose of wearing the mask.
And they have to remember too that when you're handling your mask, if the germs are on the inside from you, there's germs on the outside from others. So you want to take that mask and maybe fold it up and put it in a plastic bag, then wash your hands. Because I've seen so many of these too. They're just laying in the parking lots, and there's rubber gloves laying all over the place. It's just getting like out of hand.
Yeah, and the gloves, there's no need to wear gloves in public unless you're going to plan on doing some surgery. It's you just wash your hands, you're going to solve the problem. So that's and try not to, as I'm trying not to, I touch my face. Try not to touch your face. That's a hard one for kids. That's a hard one for kids.
It's hard for me.
Yeah,
I paid attention. My husband always says to me, "Don't touch your face," and I don't realize how often I do it. So that was I had to learn that.
It's not easy, especially for kids. So it is, but I do think that wearing the mask all the time is a really good way. Even if they are touching, they're touching the outside, and it's not going to get into their mouth.
Quickly, one more question. Should we trust the vaccination that has very limited clinical trial?
So all the vaccines there's multiple vaccines that are going through clinical trials right now, specifically for safety purposes. So there will not be a vaccine that's made public unless it does have some safety data. Long-term safety data, of course, we don't know, but all of these vaccines are vetted and given to patients. So Lehigh Valley is actually a part of a clinical trial right now. They're enrolling about 300 patients in one of the vaccine trials. So if you are interested in signing up for the trial, they are enrolling people. But yes, I would get the vaccine myself. There's going to be, we don't know when, we don't know which vaccine it's going to be, but that is going to be one key to getting rid of this virus and getting us back to some normal life.
Well, We have the fastest half hour going on all the time. Thank you, doctor, for taking time to come in and speak with us and give us all the great information. And I hope that you stay safe, healthy, and wear your mask. We'll see you next time.